Well, I want to talk with you today about the role that human services play for American Indian children and families. As director of the National Indian Child Welfare Association, we work with Oregon tribes and the state of Oregon, as well as local nonprofits, county, city, subdivisions of the state, in making sure that services reach Indian children and families. And from a child welfare perspective, one of the, I think, most important things for people to understand about the needs of tribal children and families, whether they live on reservations or in urban areas, is that most child welfare problems can be traced back to structural risk. That is, to the degree that we can impact poverty and lack of housing, untreated mental health problems, untreated substance misuse, and problems with domestic violence, we can go a long way towards reducing the need for child welfare services. So preventing the things that happen negatively for children and families. That means that human service providers have to work together. One of the things that we know in child welfare and for children in general is when the adults in children's lives cooperate, the children get much better services. Across Oregon, whether the people working directly with children and families are tribal or non-tribal workers, whether they're urban Indian organizations or mainstream organizations, the need for collaboration at the front line, where workers can sit down and talk with one another about services, about how to get services to families. It's essential that that collaboration and coordination happen. The most effective services are those that are tailored to the cultural needs of the children and families involved. And one of the major ways to get those services tailored is by working closely with the child's community. Within every community in Oregon, there are resources. For example, reservation-based resources in which the tribal government operates, social services, human services, or in the urban areas, the American Indian nonprofits who provide services. A range of services are provided by nonprofits and by tribal governments. Some of those are federally funded, some of those are funded in partnership with state dollars, and some are collaborations between the counties and tribes. But as I mentioned, the importance of that interagency collaboration and figuring out how to solve these very complex issues is essential to service delivery. I'll start with the needs of young families. One of the things we know, for example, about preventing child abuse and neglect is that the sooner families have contact with a human service provider, particularly a nurse or a parent educator, the more likely that the family will be able to provide parenting and provide what the child needs without later abuse or neglect occurring. We also know that the better housing that's available for families, the less likely that there will be problems with child welfare and later problems with juvenile delinquency. We know that the more available services are for mental health, the higher the success rate for school. We know that also for Native kids that the research shows that a positive cultural identity is associated with about 5 positive outcomes, including staying in school and staying out of trouble, fewer disruptions in their families. So we have to have a broad array of services and supports for children and families in their communities that help support families. And once they do have difficulties, a child welfare system that's responsive and coordinated so that it's a time-limited intervention with supports in the community in full partnership with the services that are available both in the urban area and the reservation area.